Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to tackle a condition that's often misunderstood, misdiagnosed, underdiscussed, and painful. It's called endometriosis. It affects millions of women worldwide, causing pain, infertility, loss of control over their body, and life. But the good news is medical breakthroughs are offering new hope. From advanced diagnostic to regenerative treatments, we're entering a new era in women's health. Joining me today is someone I deeply admire, not just his clinical expertise, but for his vision in pioneering integrative care. Please welcome Dr. Bryn Henderson, a physician, a regenerative medicine expert with decades of experience helping patients reclaim their quality of life. Welcome, Doctor.
Thank you, Dr. PENSANTI. I'm honored to be here. Endometriosis is a condition that hides in plain sight, and I'm glad we're putting a spotlight on it today.
All right, let's start at the top. What exactly is endometriosis, and why do so many women suffer for years before getting diagnosed?
That's a great question. Endometriosis is when the tissue, similar to the lining of the uterus, starts growing in places it does not belong, like the ovaries, fallopian tubes, or even the intestines. Each month, this tissue reacts to the hormones and bleeds, just like regular uterine lining. But since it's outside the uterus, the blood has nowhere to go. That causes inflammation, pain, scar tissue, and sometimes infertility. Now, the tricky part is it doesn't show up on basic testing, and its symptoms mimic other conditions. Many women are told it's just bad cramps or stress. That delay in diagnosis, sometimes 5 to 10 years, is unfortunate. I worked in the emergency room for 30 years, and fertile females that arrive with pain in the abdomen or pelvis are a very important and dangerous population.
All right, so pelvic pain is the big red flag, but what other symptoms would a woman be watching for? They say, oh, it's just cramps, but it's not just cramps because that tissue is in the abdominal cavity. So, what would be something that would distinguish between a cramp inside the uterus and a pain in the abdominal cavity on the ovaries or on the intestine?
Well, pelvic pain, you're correct, is, especially around menstruation, is the most common sign. But it doesn't stop there. It'd be during intercourse, pain with bowel movements, urination, bloating, fatigue, trouble getting pregnant. All can point to endometriosis. And some women have no pain at all, but they just struggle with the infertility. That's why a thorough clinical evaluation is essential.
All right, so what causes it?
We don't have one single answer for that, but we do have some real strong clues. Genetics is a huge cause. If your mom or sister had it, your risk is higher. Some theories point to retrograde menstruation, where the blood flows backwards into the pelvis. Others look at the immune system, especially hormonal imbalances, or even things that happen during fetal development. It's likely a mix of all these factors.
All right, so how do we diagnose and confirm endometriosis? What's the gold standard for endometriosis today?
The gold standard is still laparoscopic examinations. It's a minor surgical procedure where you insert a laparoscopic, it's a camera.
Instrument.
Yeah, you insert a camera through a small incision and look directly in the pelvis. Imaging like an ultrasound or MRI can suggest it, especially if there are ovarian cysts and things called endometriomas, but they can miss smaller or deeper lesions. So laparoscopy with a biopsy is still the gold standard.
So you don't know this, but I was the assistant surgeon on the first laparoscopy done in the state of California in 1986. And I can tell you it was the most interesting moment of my life because we've got a cannula through the belly button looking inside the abdominal cavity, but we're looking up at a television screen. I mean, today that's common because people have iPhones and they have TVs here and TVs there. Your eyes get enlarged, your mouth drops open, and you go, "What are we doing here?" But yes, we can see the tissue that's wrong and we burned it off. If it was on the ovary, we call it golf balling. We burned off the endometriosis that we could see. Sometimes it would be on the intestine. Sometimes it would be on the wall of the abdominal cavity.
Or the back of the bladder.
Or the back of the bladder. And sometimes the pain was so bad, women just go, "You know what? Just take everything out. I don't want a uterus. I don't want an ovary. Just take everything out. I'm done with this pain." This constant, like you said, even when they're urinating or they're having a bowel movement, they're in pain. What kind of life is that?
It's horrible. And it's sure hard to find if other things are not lined up. It's not common to have laparoscopy in an emergency room. However, it's becoming more and more common with some of the diagnostics that we have. And if you don't find the cause in a single visit, please continue to go until there's an answer so you don't have this suffering for so many years. These ladies, they suffer.
Oh, yeah. That said, they get to a point where they just go, "That's it. I'm done. Take it out. I want a hysterectomy, oophorectomy. I'm done." So I would like to introduce, this is my area of expertise, natural progesterone will also help dry up the endometriosis, believe it or not, especially if it's in the ovaries. And so I highly recommend you going to my website, which is www.askdrhelen.com. That's www.askdrhelen.com. I have something called Helen PENSANTI MD's bioidentical hormones, which is completely natural, not synthetic, that will help dry up these pieces of tissue that are in the wrong place at the wrong time in your body.
You were using that in what year?
I've been doing it since 89.
Think of that. So she's a pioneer.
I am.
You're the pioneer.
In hormones, for sure.
Yeah, absolutely. Okay, so let's keep moving. There are additions in terms of platelet-rich plasma, mesenchymal cells, and other methods to reduce the inflammation and support the healing.
Okay, so where do you do the PRP? You inject it straight into their pelvic area?
Depends on where the inflammation is, but yes, you can do it. I've done all three of them right on to ovaries.
With ultrasound guided?
Yeah, absolutely.
Interesting.
In both PRP and MSC injections, the pain drops significantly. It's not a cure, but I've seen it and it's powerful and gives you a long-term recovery.
And joy of being able to get pregnant.
Yeah, big. Yeah.
Absolutely.
Yeah. If the pain's severe and there's infertility, I think they need to see an obstetrician and have some discussions in terms of.
Well, a specialist in infertility.
Yes, absolutely.
Yeah. Not all obstetricians are specialists in infertility. So you want to go to an infertility specialist who is an OBGYN.
That's right.
So what about lifestyle? If they're always in pain, when they go to the bathroom, they're in pain. When they're having sex, they're in pain. When they're having a period, they're in pain. What time of the month are they without pain?
I wouldn't even tolerate it. I don't think it's right to be in pain. Yeah. I think they need to see somebody right away who takes charge, determines causation, and lays out a protocol, a plan, and the plan should include the dietary facets, the exercise facets, and the necessary hormonal balances that you alluded to.
Yeah. So, physical therapy, what do you think?
Well, I think it has to be combined with other things, but you've got to have something to reduce the stress too after you go through this. This is a horror story.
Yeah. What about your acupuncture that you like so much? You notice I'm not quite where you're at with acupuncture.
Well, I've had the blessing of seeing it benefit. And in fact, there's even ways in which that helps instead of anesthetics. So unfortunately, this doesn't help as often as we'd like. So
Yeah.
sometimes you have to get those removed. The cysts, although rare, it can cause bowel and bladder issues, or even increase the risk of certain types of ovarian cancer. So an early diagnosis and proactive care are vital.
All right, so now we've brought them in, we put them on medicine, we've done all the anti-inflammatory IVs, we've done all. How do you follow up with them? How often do you make them come back to make sure that they're stable and that their pain level has subsided enough where they can lead a good life?
We see them every month for the first year, or every 6 months. We don't really go annually. We go every 6. You see them every month until this menstrual cycle terror is gone, and then you calm them down, and then what you do is you take their hormone side effects, that gets into your world health,
Right.
and make sure that they got to get back into balance and have their return to normal symptoms.
All right, well, let's do our mnemonic for endometriosis. Relieve. R stands for
Recognize the symptom.
E.
Is establish a care team.
L.
Is the lifestyle changes.
I.
Inform your doctor of any changes.
E.
Explore treatment options.
V.
Is validate your experience.
E.
Is educate yourself and your family.
And I would say find someone who's sympathetic and has empathy and understands a person's pain and doesn't just write you off as saying, oh, it's cramping from your period.
Couldn't agree more.
Well, thank you for being with us today. I know endometriosis is complex and we've talked about enough for you to get proactive. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.